You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, dental implants. According to my first guest, no more dentures. With us, we have an expert on the topic, Dr. Locante. Dr. Locante, welcome to the program.
Randy, thank you very much. It's great to be here.
Now, we've had you on the program before.
Yes.
And we should mention, I'm not trying to side with you today. This is for people tuning in, this is a real interview, but you probably have, and I've had my TV show for 15 years. You're probably the most experienced guy when it comes to dental implants that I know. I mean, you do more implants, I guess, in a week than most guys do in months. Is that right? Is that fair to say?
That's what I understand.
So all you do is implants?
That's all I do. That's what my practice is. It's all implant and implant related.
And you teach, you lecture quite a bit.
I do.
Tell me about that.
I've had the opportunity of lecturing all over the world. This wonderful art and science has brought me all over the world. I lecture nationally and internationally. I still teach at the University of Tennessee.
Is that right? What do you teach there?
Where I'm an associate professor in the Department of Graduate Periodontics. And I get to work with those wonderful young residents and work with their eager young minds and help expose them to dental implants and I teach them varying techniques, all the way from simple techniques to more advanced techniques. And so that keeps me busy.
Is it true what we said at the top of the show, no more dentures? I mean, at least the way we know them today, that they'll possibly all be attached to something?
Oh, absolutely, absolutely. 95% of all denture wearers can't even wear their teeth.
Really?
Okay, yeah. And most of them take out their teeth to eat. There's 5% of the denture wearing population that they could chew down a tree. All right. And of course, I'm not going to be able to help that segment of the population. Right. But the other 95% is the group that we see. Okay. And these patients are suffering. They can't chew their food properly. They gag on their food. I mean, a lot of times what they're doing is they're swallowing their food whole. They have digestive problems. They have all sorts of problems that are associated with wearing dentures.
How big of a problem is it, by the way? I mean, are there a lot of denture wearers in Tennessee or in Nashville in particular?
Well, throughout
throughout
the United States, there's over 33 million denture wearers. 33 million. That's the entire population of Canada.
Okay, so would you say that there might be tens of thousands in Tennessee with an upper lower denture?
Absolutely. And people are losing their teeth every day.
Now, we talked about your experience. Does it cost more to go to somebody that is a specialist, or this is what they focus their practice on?
No, it doesn't cost any more to go to someone that specializes in this particular art and science.
Okay, good. So what are the categories of dental implant patients that you see?
Well, I see patients who have one missing tooth, all the way to people who are losing their bridge work because the teeth underneath the bridge work are decaying. And I see patients who have lost all their teeth and who have been in dentures for some time and are absolutely miserable.
Okay.
So and a part of the reason why these patients are miserable is because our mouths were really never designed to wear dentures.
All right.
Okay? Because what happens is that our bone in our jaws exists for one reason and one reason only, and that's to support a healthy tooth root. Once the root is removed, that bone breaks down or that bone begins to resorb. And then when you put a denture on top of that, that exacerbates the situation. So it speeds up the bone resorptive process. So these patients, as they go on, every 3 to 5 years, they have a new denture made, and their teeth get set further back in their mouths, and their midface starts to collapse. So
interesting.
If you've ever seen these patients who have, or these people who have their nose and their chin look like they're really, really close together. Okay, well, that's what's happened.
Interesting.
They've probably been wearing dentures for several years.
But is it true that if somebody's been wearing dentures 30, 35, 40 years, it's too late at that point? They don't have enough bone for dental implants?
No, that is not true.
Okay.
That is not true, because there are certain procedures that we can do to help enhance the sites. Okay. And if patients want to go through the procedures that will get them there, we can get them there.
So you don't turn people away then?
No, not at all.
If they're willing to move forward with it.
Not at all. There are different types of procedures, different types of implants that we can use, and there are custom implants that can be done as well for even some of the most resorbed cases.
So if it's as good as you say it is, getting for denture wearers, why aren't they all doing it? Why aren't they all getting? Because you say 4, 6, or 8 implants, they can get a full arch of teeth that don't come in and out.
Right.
So why aren't they all doing it? What's your take?
Well, I think the biggest fear is the fear of pain itself. You know,
It does seem painful.
They think it's going to be a very, very painful
But
procedure,
isn't it painful?
and it's not painful. No, they feel no pain while we're doing the procedure at all.
Okay. What
And-
about afterwards?
Well, you know, sometimes they can have a little discomfort, but we usually give them medications to go on ahead and cover that. Well, I just had spoke to a patient the other day who had just had the procedure done, and because I call my patients all the time right after the surgery.
You do?
I absolutely. I call them either that evening or the next day. And this particular patient says to me, she goes, "Okay, so now when am I supposed to start feeling the pain?" I said, "Well, aren't you feeling any discomfort?" She goes, "No, not at all." I said, "Well, then, you know, that's usually what most of my patients say."
So, but pain is one of those things. Okay, so what's another reason why they don't all do it?
Well, because some patients think they're too old.
How
okay?
old can you be to do it?
The oldest individual that I have placed implants in is 96.
Really?
Yes, 96
Aren't
years
they
old.
more likely to fall out though at that age?
No, not at all.
Really?
Not at all. Bone will heal, okay? And she healed very, very well. And what we were doing, we were stabilizing a denture for her. And her physician had thought it was an excellent idea, even at her age, to be able to have that done so she could eat and chew and be comfortable. At 96, I think she passed away at 101. Okay.
So 80, 90, not too old for dental implants.
No, not
so a
at
denture
all.
where,
Not
and
at
so
all.
there are those.
But the nice thing about that particular patient was that she was able to eat and chew some of the foods that she liked for the time that she had left, and that was really, 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 really heartwarming for me.
You know, I was talking to my father about this, and he said, "You know, Randy, the last thing I want to do, denture wear 30 years, is go to a dentist." He goes, "I was glad when my teeth came out." So do you think there's certain people that they fear the dentist? Like they just don't want to come see you?
There are a lot of patients that have lost their teeth that don't want to go to the dentist anymore. Absolutely, and so
Do you hear that still, where they say, "No
yes,
offense, doctor"?
Absolutely, yeah. I don't like you because you're a dentist, or I don't want to come to you because you're a dentist, and a lot of these patients who wear dentures fall out of the recall programs of dentists. So.
Okay. Now, you brought photos.
Yes.
But before we get into that, what are the options for denture wearers? Obviously, if you're missing 1, 2, or 3 teeth, you give them their teeth back. But what are the options for denture wearers as far as numbers of implants?
Well, you can stabilize a set of dentures with as few as 2 implants, okay, and go all the way up to 8 implants, and not have to take the dentures in and out anymore. Okay,
So it's a full arch of teeth.
full arch of
with
teeth.
6 or 8
Actually,
implants.
6 to 8 implants. It becomes like a fixed bridge. Okay, what we call a fixed bridge. The only one that can take it out is the dentist.
Okay, and you have metal-free options
We have
nowadays.
metal-free options as well. Yes, all zirconia restorations, or all zirconia teeth, or all zirconia bridge work, and all zirconia implants. As a matter of fact, for those individuals who have true metal allergies and/or who follow a holistic approach or just want to be metal-free.
Now, you say you're changing people's lives when you give them dental implants. Elaborate on that.
Oh, absolutely. Just their personalities, they come back to life. Okay.
Okay.
They come back to life because a lot of these patients they're embarrassed to go out. They're embarrassed to date. They're embarrassed to do any of these things.
They tell you this on the consult?
Absolutely. There's some things I can't share with you that they tell me.
Okay.
But yes, they tell me a lot of their deep personal fears. Okay. And so what we're able to do is we're able to bring confidence back again for patients. Confidence, the confidence to be able to go out, eat, socialize, just get back into life again. Okay. And that's one of the greatest things. Like, take a look at this particular patient right here. Okay. Now, the eyes just tell the story. Okay. She hated her smile. Not only did she hate her smile, but she also had problematic teeth underneath her bridge work. Okay,
Okay, is that all bridge work? Is that what's going on?
That's all bridge work. That was bridge work that was done over the years, and in that bridge work, her smile line was never corrected. But now at this particular point, she was about to lose all of her teeth anyway.
So they had to go.
So they had to go, okay? And so her option was a denture, which she wanted nothing to do with because she didn't want anything to go on the roof of her mouth. Okay?
That's young to be wearing a denture.
Very, very young. I mean, in my opinion, anybody's too young to wear a denture, okay?
Okay.
Because our mouths were never designed to wear dentures, okay? And that's what a lot of people don't realize. Because like I said earlier in the program, you know, once you take out those teeth and you put a denture in the patient's mouth, it just speeds up the bone loss process, the bone resorption process, okay? So let's get back to this particular patient here, all right? What we did was we were able to support an entire arch of teeth on 8 implants, okay? And
what about the roof of the mouth, like a denture?
Nothing. Nothing on the roof of the mouth.
Okay.
Okay. This was an all zirconia restoration. Okay. And what I want you to notice is that not only look at the patient's eyes from
yeah, she looks different.
From where, I mean, she's smiling with her eyes with her final teeth in. You see that?
Yeah.
But also look at how beautiful the corners of her mouth look. Look how beautiful.
So it's like a cosmetic
Absolutely,
case.
absolutely. You can't separate cosmetics from implant dentistry. Okay, and so what we have here is we have a situation where we've not only restored the smile line, filled in her lips and a nice, beautiful, even smile once again, you know, but we've restored her confidence, and her confidence comes out in her smile and in the smile in her eyes.
So when it's all done, what do they say? What do they typically say?
Well, what this particular patient said was that she should have done it years ago. Okay. And the thing is that when I first handed her that mirror or let her go in front of the full-length mirror to let her look at her smile, tears just start coming down her face.
Really?
Oh, absolutely. And she just said, I love it. I love it. This is the smile that I've always wanted.
So they wanted to do it years ago. So with most people, are they just worried about the cost? They're worried about pain? They think they're too old?
Yeah, I think all those things come into play. You know, they're worried about the discomfort, and really, this particular patient as well was one of those other patients that had said, it really doesn't hurt. It's not an uncomfortable procedure. She did not take any pain medication for this particular case.
Now, for dental implants, as far as insurance, I guess insurance doesn't cover it here or in Canada. I guess just part of the procedure, is that right? And
yeah.
Medicare doesn't cover this at all?
Right. There are some insurance companies that do cover a part of the procedure, okay? But there are those that don't. And for those individuals who have insurance carriers that don't cover it, there are payment plans that are available, and
so you'll work with their insurance company.
And we try to accommodate all the patients if we possibly can.
Okay, good. You have more photos. What are we looking at?
Yeah, absolutely. All right. So let's look at this particular patient here. Okay. This particular patient right there.
Oh my goodness.
Yeah, you see that? And that particular patient came in, and he was just devastated. He didn't want to smile. This also happens with men too, okay?
All right.
But it took him to get to that point.
But is that unusual, though, to see that? I mean, I've never seen anything like this.
No, for me, it's not unusual to see this. I see these patients all the time, you know, and they come in and they'll say, "I bet this is the worst smile you've ever seen."
They say that.
Absolutely, and I'll tell them no. But the thing is, you know, I mean, a lot of these patients are walking around, and you see these individuals out in public, and they're not smiling at all. Okay.
Good point. Okay, so they're hiding it.
They're not. Yeah, and so you just think they're in a bad mood, or you think they just don't want to socialize or be social. Or a lot of these patients will always put their hand over their mouth so no one can see their teeth. Okay. So this individual comes in, and enough was enough for him. So
these teeth had to be pulled out.
All of them.
Okay.
All of them had to go. And in this particular case, we were able to support a full set of upper and lower teeth with 5 implants on the top, 5 implants on the bottom.
Very nice. But what about their gums? Like in a case like this, if their gums are too bad, can they still hold dental implants in there?
Oh, absolutely. The thing is this, is that once we remove the unhealthy teeth, the gums get healthy again.
Okay.
And so then it's also a matter of the bone underneath. Okay. So once we remove the unhealthy teeth and the gums get healthy, and we preserve the bone underneath, then he had, like this particular a patient right here. He had sufficient bone to be able to place just 5 implants and support 12 teeth, okay?
Okay, so they can eat and chew whatever they want.
They can eat and chew whatever they want. His teeth did not come in and out of his mouth.
When it's all done, how soon can they eat like something tough, like I guess broccoli or?
Oh, once the procedure's complete, they can start eating that day.
Do they ever tell you food stories?
Well, I hear food stories all the time. And one of the biggest food stories, like this particular individual, he went out and got a steak, something he could not eat for years and years and years, even with those broken down teeth. Of course, if you looked at those broken down teeth, you wouldn't think you'd be able to eat with them anyway.
Yeah.
Then the other thing too is that there are several patients who say that they eat corn on the cob and apples again. Okay. Now I always warn these patients that you have to be careful just because you have a mouthful of porcelain. But the truth is that they're able to eat again the things that they once loved: salads, corn on the cob, apples, steaks, foods that require serious chewing.
So no more dentures.
No more dentures.
And you love this. I mean, we were talking in the green room.
Yes.
And we were asking about something, and you said, I mean, you think about this all the time. I mean, you think about dental implants all the time.
Yeah, you can even ask my wife that. She'll tell you the same thing.
I mean, you lectured other dentists about it. You think about it.
And I'm always trying to modify ways to be able to make things better for our patients.
What's the most gratifying for you about the whole process?
The most gratifying for me about the whole process really is being able to take patients like this and then get them back into life again. Okay, these patients become recluses, and they don't want to go out. They don't want to socialize. To see them and their smiles and just how happy they are and the transformation that they've made, is just truly gratifying for me.
So, are you saying there's no, I don't want to put words in your mouth, but there's no such thing as a happy denture wearer? Like, I know a few denture wearers and they don't complain about their denture.
Well, what you have to understand too, Randy, is that patients adapt, or people adapt, and you can adapt to almost anything.
Okay.
And sometimes they don't know that they're not unhappy because they've adapted to what their ill-fitting denture allows them to do.
Okay, and this is one of those things where everybody says I should have done this years ago.
Absolutely. All the patients that I treat will say, this is a procedure I should have done a long, long time ago.
And if there was a try-in period, like you say tens of thousands of denture wearers, if they came in and you could somehow just give them a fixed set of teeth over the weekend with dental implants, none of them would want to go back. Do you believe that?
Oh, to denture? Absolutely.
Yeah. So they don't know what they're missing.
It's been my experience with denture wearers that once we support or get enough retention and support in, they would never go back to wearing dentures again.
Okay, good. And do they tell their friends? Because denture wearers are hanging out with other denture wearers. Do they give you referrals, or is it a private thing? Because
I think it's a private. Yeah, I think it's a private thing because I get referrals from other patients as well. But most patients don't want to tell other people that they have implants done.
All right. Now I know you don't like bragging about yourself, but people travel. They get on planes to see you.
Oh,
is that right?
Yes, I've been fortunate that way. Yes.
And dentists? Do you ever work on dentists?
I have many patients of mine who are dentists.
That
I treat a lot of dentists.
Is that right?
Absolutely.
Okay. Now you brought more photos. What are we looking at?
Yes. Here? Okay. So this is another patient. This particular patient right here. Okay. Now I want you to look at the eyes. All right. As well as look at the smile. One smile over here. This is her with teeth in her mouth.
So she's not smiling.
That's her smile. That's what she shows, okay? And you can see she's a happy patient. She's a wonderful, wonderful patient. She's happy. She's a happy person overall. But look at her eyes.
But you wouldn't know it. Yeah.
Of course you wouldn't know it. Not by looking at that.
Okay.
This woman is probably prejudged for not smiling a bunch, but this is how she smiles, okay? And this is her smile with teeth in her mouth. She has bridge work in her mouth on the upper and the lower. And
so you actually told her for the photograph, smile.
That's it.
And that's it.
Absolutely.
Okay.
That's it. I told her smile, and that was her smile. And of course, you can see that she wasn't very, very happy about that.
Okay.
Okay. Now, this is the transformation.
Very nice. What'd you do?
So with this particular patient, okay, what we had done was because she did not want to wear any dentures at all, nothing that would come in and out of her mouth. So for her, what we did was we extracted all the teeth that needed to be removed, okay? We placed 8 implants on the top, we placed 7 implants on the lower, gave her fixed bridge work, and this is the transformation. Not only was it a transformation in the smile, but it was a transformation of her personality, her heart, everything. You could see in her eyes.
Wow, so this woman could eat, chew, do whatever she wants.
Whatever she wants.
And those look real. I mean, they don't look like a denture.
And no, of course not. But she has a nice, beautiful, vibrant smile again. And just like I say on all the other patients, look at the patient's eyes. Look at the eyes. The eyes smile. You see that? The eyes smile from here to here. And that is how you tell if a patient is truly happy. So let me show you this next patient.
Okay.
This was a dramatic transformation. Dramatic transformation. As a matter of fact, this patient would not even allow me to take a picture of her with her teeth. I could take the teeth, but I couldn't take a facial shot. Okay?
Interesting.
Because
wow.
she was just that embarrassed. And when she came into the office when we were doing the initial consult, she couldn't stop crying. She was crying through the entire consult.
Wow.
Oh, it was heartbreaking, absolutely heartbreaking. So let me show you this case.
Let me take a look at this.
Absolutely. So this particular patient was, and she was crying, and she wore a partial denture, all right? She only had 3 or 4 teeth that were supporting that partial denture, but as you can see in the photograph, it just was horrendous, and she always covered her smile.
Now, do you get excited like when you see this kind of a case?
Oh,
like where you go, boy, this is going to be good?
Because I can see ahead of time what this is going to be. Poor patients can't do that, but I can look at a case and say it's going to look like this. It's going to be beautiful, and that's what I told her. And so I said, this is what we need to do to get you there, and this is what we can do. And so when we were able to, we had to remove her teeth. When we were able to take out all her teeth, get her all cleaned up, get everything nice and healthy, a nice, beautiful, healthy foundation, we were able to place 8 implants for this particular patient and put a beautiful all zirconia restoration up.
So a full set of teeth?
Full set of teeth, and it's absolutely beautiful. Look at her smile. Look at her smile.
It's a pretty smile, by the way.
It's a sexy, beautiful smile. Absolutely. And
you would never think when you look at the before that you could have done that.
She's a beautiful, beautiful woman, and for her, when we put her final teeth in, it was another one of those emotional times, crying.
So they get the mirror and they cry.
Oh, absolutely. And she was just so happy. This is something she should have done a long time ago. Now, this is something else. Her husband was in full support of this. Okay. And so her husband had told her at the consult, sweetheart, don't worry about what it is that as far as the financial is concerned, I want you to have a beautiful, healthy smile. And that's what we're able to do for her.
It's just very nice. So there's a lot of people like this thing.
Absolutely.
They're all over the place.
Absolutely.
And they wait, right? Because nobody likes going to the dentist. I mean, is that your take, that they're just, it's the fear of the dentist?
Absolutely.
The fear of the pain, the fear of the cost, like you discussed?
I think all those things. Fear of the dentist, fear of the pain. And really, there's not a lot of discomfort with these procedures at all.
So don't let pain keep you from going in there.
Oh, absolutely not. Because there's no discomfort during the procedure whatsoever. And we also offer IV sedation, from IV sedation all the way to general anesthesia as well.
So sedation, so they go in. I think you told me, sometimes it's all done and they wake up and they don't even know that they had it done?
Right.
Is that true?
Absolutely, absolutely. And that's how a lot of patients who have apprehension or fear will IV sedate them, okay? Or we use general anesthesia as well.
Now we're out of time. Great stuff. They can find out more about dental implants on your website.
Absolutely.
Final message to the person watching this, and maybe they're thinking they're too old, they're still worried about pain, maybe they're skeptical, but they're wearing a denture. What do you say to them?
Well, what I would say to them is that I invite them to come in to have a consult done. So then we can go on ahead and discuss their options with them.
Okay, good. And if they want to find out more about, because you're doing these metal-free.
Oh, absolutely. They can go to our website, they can go to my website and find out more about the metal-free implants.
Okay, good. I want to thank you for coming on the show. Always a pleasure.
Thank you very much.
Thanks for coming back.
Thank you very much.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, you can go to our website at Wellness Hour and just put in Tennessee Dental Implants, or of course, Dr. Locante. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.